Hello. How's it going? Hello, everyone. Hi. My name is Edis, or Iris. I am an intern with Pandia Health this summer, and today I will be talking to you guys about some topics that I'm very passionate about. I am a rising senior studying biological engineering at MIT. At Pandia Health, I am making blogs, and I'm a content creator. Tomorrow I'll be doing a live in Spanish. So if you guys are Spanish speakers, you should check me out. And yeah, today specifically we'll be talking about hormones and side effects, and how specific hormones, sex hormones, play into the side effects, especially when it comes to birth control. So if you are new to Pandia Health, welcome. We are a birth control delivery company, the only female-founded, female-led, doctor-led birth control delivery company out there. And currently we have a program going on that we're giving financial assistance to people who may need it for getting their birth control to them. So on top of free delivery, we'd be giving the birth control as well if you are in need of financial assistance during these times, because it's we understand a lot of people may be needing the assistance. So the link for that is in our bio. Check it out. We also have an Instagram. Well, you're on an Instagram. We have a YouTube. We have blogs that we update constantly, just coming out with different news and trending topics. And if you are thinking of subscribing to our service, make sure to use my referral code EDIS, or Iris, IRIS. And yeah, but let's get into today's topic. So when you hear about birth control, there's a few side effects that you probably think about, like well, the good one that I like to think about, and us at Pandia Health like to think about, is like being able to skip your period. And then there's other ones that may be like weight gain, bloating. Well, actually that's a period one. Maybe you think about mood swings. You think about cravings. So we're trying to debunk that, or if not debunk, trying to understand a little bit more like why these things happen. So when considering making periods optional, that you can do that by taking only the 3 active weeks in your pill pack and then skipping the last week and just going straight into the next one. And basically you're tricking your body into thinking you're pregnant. Last time I did a live, I talked about those hormones. Be sure to check out that video on our YouTube. But there's a few different forms of birth control that let you skip your period. Like the pill lets you control it a little bit more, but then there's some more permanent forms like the hormonal IUD and the arm implant, which have some variability in how you are able to skip your period. Some people see different effects on it. And so the pill, the ring, the patch, well, the patch not as much, let you skip. So the pill, the ring, and the patch are what Pandia Health delivers. But with the patch, you shouldn't really be, you can't really skip it the entire time, because you're, the lining builds up a little bit much. So Dr. Yen has a video about this on our website, so you should definitely check it out, why the different forms of birth control, how they let you skip your period. And then another side effect that comes with your period, and oftentimes with different forms of birth control, is spotting. So spotting, or sometimes called breakthrough bleeding, comes with a few different forms of birth control, like Nexplanon, which is the arm implant, and the hormonal IUD. So sometimes the lining of your uterus, the endometrium, isn't adapting fast enough. It just it doesn't thin out as fast as it needs to. And hello. Yeah, so sometimes it takes up to 3 months to get used to your birth control, so it just bleeds in the meantime. And what you do normally during that time is allow for a little shedding of it, and then come back onto your birth control so that it stabilizes better next time. So that's usually what happens in the first couple of months that you take a birth control. So that's the spotting is just the lining of your uterus not being adjusted to the pills. It's not thin enough. It's not cooperating. Some people don't have as much estrogen, which is what stabilizes the lining of the uterus, so it just keeps bleeding out if you have progesterone only forms of birth control. Another great side effect of birth control pills, though, is stopping acne, which was great for me when I started taking my birth control pills, because Lord, did I have a lot of acne. Yeah, so mostly the combination pills are really good for this because they reduce the number of androgens in the blood. So androgens are typically known as the male sex hormone, but your ovaries can also produce these hormones, or when they produce the other hormones that they're producing, these get turned into androgens, and the androgens are circulating a little bit more in your blood, and they cause the sebaceous glands, which are your sweat glands, to produce to be, I guess, more oily, and that's what causes the acne. So when you're taking birth control, that calms those down so that your androgens are kind of brought down to a different, like a lower level. And then you don't have acne, which is great. And then if you're on a progestin only birth control and you come off of it, usually that brings back a little bit more acne than the people who are on the combination pill. So that's something really important to take into consideration if you're taking birth control to stop your acne. And then some other forms that could be side effects. People think that maybe you'll gain weight if you take the pill, but that's actually, Dr. Yen goes into it in some of our YouTube videos, but it's been shown that on average, females which are on the birth control pill weigh 1 pound less than females which are not. So that's what the studies are saying. So there's actually no weight gain usually associated with that. And I guess going off of that, the hormones which cause bloating and weight gains and cravings, and like when you want salty things or when you want chocolate right before your period, that's actually progesterone, which is one of the 2 sex hormones released by the ovaries. So it causes the munchies, it gives you salt cravings and chocolate cravings, and it causes more water retention around that time too. So those are the main side effects. So yeah, if you're on the pill, the levels of these are balanced out and you don't have to go through the ups and downs. Hello. Yeah, so that's why people who are on the birth control usually weigh less, because they're not going through the ups and downs. They're not going through these intense cravings right before their period, which have been proven through that it's progesterone that's causing it. And mood swings, that's another thing that people are concerned about. So there's been some studies done on this. I was reading up from Harvard that there's a risk with everything, and there's higher risks associated with progesterone only forms of birth control. So that's definitely something to take into consideration. But yeah. And if you guys have any more questions, be sure to check out our blogs and our YouTube channels, and there's going to be a few more videos that I'm going to make, so definitely let me know if you have any more questions on the hormone side of it, because that's what I'm more interested in. And be sure to check out Pandia Health. We are the only female-founded, female-led, doctor-led birth control delivery company out there. We currently have this financial assistance program going on, which I explained. And in our birth control delivery bags, we include cute goodies, which you should check out. And if you're in California, Florida, or Texas, you can get a telehealth prescription made by our doctors. So that's awesome. Thank you for watching my IG Live. I'll also be here next week around this time. and use my referral code Edis or Iris and sign up today. Link in our bio. So thank you guys for tuning in. I'll see you guys next week. Bye.